This might be for life. Yeah. This might be for life. Stand up when the chief is here. Hands up. Yeah, the chief is here. Stand up when the chief is here. Hands up. Yeah, the chief is here. Yeah. This might be for life.
Good afternoon, everyone. And we've got such an exciting show on today. The chief is right here. Actually, he's sitting next to me and keeping an eye on me. George Goldsmith, what a treat to have you here. We were introduced 2 weeks ago by a great friend of mine, Anton Bilton in London, who I've known for 25 years. And for over 10 years, my wife's been saying, forget about cannabis and these things. Psilocybin is going to be huge because it really has properties that can change the world, can help people. So for 10 years, she's been telling me this. And all of a sudden, Anton tells me that this extraordinary man has built a business, Compass Pathways, and raised $80 million in a Series B. But for the folks here, more equally important is George trained as a cognitive psychologist, a clinical psychologist, and did computer science. Plus he's been with McKinsey, plus he's YPO. So if you merge all of these things together, you get someone that's smarter than me and Kim West, who's on the show tonight, put together. And we'll introduce Kim in a minute. George, over to you. I know you've got some slides to put on, but
thank you so much, everybody. And it's great to see you in this somewhat surreal environment that we're all living in right now. One that I think is going to really demonstrate the importance of mental health and really looking at this. And I don't see the slides on my screen yet. Are they showing for anyone? There we are. What do you know? So the focus for me today is going to be share a little bit about our journey and about getting what we're up to. And so Compass Pathways started, like so many things in life, with a personal experience. And our personal experience was in June of 2012, our son called us, and he had been really struggling. He had just gone off to uni and been really struggling with anxiety and depression, and it had become quite difficult. And he called us and he was incredibly distressed. And this is something we'd never seen, never heard before in his voice. And it started a journey where he had a massive side effect from one of the antidepressants he was being prescribed. And we nearly lost him 3 times in a year. And this was profoundly impactful for my wife and for me. My wife is a physician in internal medicine and environmental medicine, and she likes to run toward things. She was the first physician on site at Ground Zero and actually treated a lot of the workers there. And that became the congressional study on the health effects of 9/11. So not a shy woman. When her son got sick, she just kept doing research, and one woke up me probably in February of 2013 and said, I just read this study of something called psilocybin. And it was a study done maybe 5 years ago on people with OCD. Everyone got better. You don't see that with OCD the day after. Now, they didn't stay better forever, but it was an important sign. And she woke me up and said, hey, you were in the 60s and 70s. What do you know about this stuff? And it turns out quite a bit. I actually went to university, and the reason I went into cognitive and clinical was because I really wanted to work in psychedelics, because I found them really interesting back in the late 60s and early 70s. So life has a funny way about it. So we started to learn more about this area of treatment. We learned about other things that were happening that were not the traditional SSRIs and antidepressants. We were able to find our son the use of ketamine, which is it's a tranquilizer or an anesthetic agent that's been used in depression. That helped him. He was very much helped by psilocybin when we learned that there were hundreds of people still using this underground to improve therapy. And think of the risk of using an illegal substance with people who are struggling mentally, and yet people finding the value of it and using it underground illegally. So this is a really interesting area. We became major donors in this area and funded studies at Johns Hopkins, NYU, UCLA. This is us personally, London Imperial. And out of that, what we did was realize that papers are great, patients are in need. How do we move from all of the academic research into developing this as something that could be used by patients around the world? And that really started the journey that we are on. The other thing is, Rob mentioned that I'm part of something called the Young Presidents Organization. I was on the board there for quite a while internationally and have a lot of YPO friends. And obviously, when this kind of thing happens, you reach out to your friends. And I spoke with my friends and I started hearing their stories. So it wasn't our story, but it was many people's story. When I do this talk in live groups, I've done up to 2,000 people. What's happened is I ask people to raise their hand if they or someone in their family have been touched. 95% of the organization or of the group talks about, yes, I've been touched somehow or someone in my family. So while this starts as a story of my wife, our son, myself, it's actually all of our stories. And we all have a story, someone we know. At the far, really difficult end of this bit, we have a statistic that just came out last autumn, and it's a really frightening statistic. But every 40 seconds, somewhere on the planet, someone commits suicide. And in that same period, 20 other people attempt suicide. And all of those people have social networks, families, friends mostly. And so this is the leading edge of this really awful, awful crisis that we are in, that really motivated us to do something about it, because we're people who at day's end have a bias for action and really want to make a difference that matters in the world. So we decided to create a company, and not a biotech company, but a new type of company, a mental health care company. What do we mean by that? Well, it's the 21st century. And what we mean by that is the fact that we're looking at how do we bring technology, therapy, psychotherapy, new types of medicine, innovation, all together to improve mental health care at scale. So our commitment is to accelerate patient access, do everything we can, and also for us to do that in the most rigorous fashion. I think there's a tremendous amount of work being done by some really wishful thinking is probably the most euphemistic thing I could put about lots of people who are developing little businesses, little approaches for taking magic mushrooms, hoping for decriminalization. That all might happen, but our whole focus is on science, rigor, working with countries at country level on how to transform mental health. I've told you our story. And what we're really focused on initially is psilocybin therapy for what is euphemistically often referred to as treatment-resistant depression. What does that mean? It doesn't mean that the depression is fighting treatment. It doesn't mean that the patient is fighting treatment. What it really means is we don't have a clue what to do with these people and how to help them. And that's really what we need to focus on. And our work has been recognized by the US FDA. We have breakthrough therapy designation, which means they see that what we're doing could really make a difference that matters for patients, and therefore are doing everything they can to help us get to patients. I think in terms of lots of reviews, and part of my background is working on access to medicines issues, certainly doing work with major pharma, Western countries, and also doing a lot of work in sub-Saharan Africa in the mid-2000s on access to medicines and HIV. The particular focus we're taking initially is depression. It's not limited to depression, but it's where we're starting. Why? Because it's a huge, huge issue. And I think we just need to look around us in our personal lives, whether it's ourselves or others, that it touches many people. We're focused on treatment-resistant depression, so-called, because that's where people really suffer. About 60% of people are helped by what's out there now, But given the numbers, the 40% who aren't are driving huge amounts of cost, huge amounts of impact. And that's what we're really looking at. Can we make a difference for those patients? And that's really what brings us all to work every day. Our vision is pretty simple. It's to create a world of mental well-being, first starting with this population of people who are really suffering in terms of being disconnected from their lives, from their friends, from their families, and quite often being in a very kind of internal prison of thoughts and negativity. And how might we shift that? And so our journey is really about, and this is a journey, this is a big ambition to make a difference that matters at scale around the globe. So right now, as we look at what we're doing, it's all about transforming the patient experience in mental health. I had the privilege of working with governments at one point to post 9/11 in the US. And we had someone there who described something as saying it's a target-rich environment. He was looking at just all of the terrorist threats. I think mental health is a target-rich environment. There's so many opportunities for excellence, euphemistically, so many things we can do. And what we're working on is developing psilocybin therapy in partnership with centers where we're actually creating physical spaces to really look at what the future will be like in mental health care with some of these substances. We have 2 of those in the US that will be opening this year. We're also working with the largest insurers and governments across the transatlantically to really look at how do we get this to patients. And our vision at scale is to have a world of mental well-being. It's not just to help people be suffering a bit less here and there, but to really look at how healthy can we be, not just how do we remove pain and suffering at sort of the most intense levels. Or as one of our investors says, why stop when someone's merely miserable, but they're no longer suffering profoundly? We agree with that. So a little tiny bit about the science. What was really remarkable is after 40,000 people from 1950 to 1967 or so received LSD or psilocybin, 2 psychedelic drugs in clinical trials, it just went dark because of the 60s and confluence with Vietnam, all of those things. So the research really shut down, and it wasn't until the late 90s when a very bold group of people, scientists, decided, well, why don't we take a look again? And they did that. And so this is a set of studies that really led us to say there's a there. It led us to get excited. The more we talked to people, the more excited we became. And what do these charts and graphs tell us? Something really simple. A single dose of psilocybin, a high dose. We're not talking about microdosing for those of you who may be familiar with that term. We're talking about a large transformational experience in a safe environment. Don't take this at home, but in a safe environment. What happens is after the first dose, and that's usually the line at the very, on the right-hand side of this, I'm sorry, the left-hand side of the charts, in each of these charts. People are depressed, they have a single dose, no additional medication, they come off all their other medications, and they stay better for a fairly long time, weeks, months, and occasionally years. That's never been seen with medicine, and it's largely because we have a different kind of a shift in how people see and think about the world. So that's what we do with our therapy. Doing a little bit of a double click down into, well, how does this work? This is the active ingredient in a specific form of mushrooms called psilocybe mushrooms. They grow all over the world. They've been used for thousands of years, where there are indications of these mushrooms in ancient civilization. So we know that they've co-evolved with us, and there's lots of different ethnobotanical thoughts about that. But what psilocybin is the active ingredient in that, and that's what we're making as a medicine, as a pill. We're synthesizing it. No mushrooms are harmed in any of our work. This is something we do chemically. And it's well tolerated. It's quite safe from the early research we're doing. And that's a lot of our research is looking at the safety and how well it works. What happens is it almost operates the opposite way that traditional antidepressants, which tend to dampen one's experience. What this does is it really has a cascade of an impact on the serotonin system. And if you think about what serotonin does, it basically is a switch, it's more like a valve between what one experiences in the outside world through perception and how much that gets balanced with what goes on in your inner life, predicting what's going to happen next. And if you think about people who are suffering from anxiety, depression, quite often they become very internally oriented, very deeply self-absorbed. And this mechanism of action seems to free them from that tyranny. And we see that in all sorts of brain scans. Interestingly enough, we didn't know any of this about psilocybin until about 2006 with the advent of functional magnetic resonance imaging. So there's a physical effect that basically has the part of the circuit of activity in your brain that is active when you think about the future, reflect on the past. That gets really quieted with psilocybin over a 4 to 6 hour period. The blood flow reduces, the activity reduces. Quite often people have a sense of being one with the universe because their ego kind of gets out of the way. You can imagine some politicians who might benefit from this. So this is how we think that this operates based on the most recent science. What does this look like in the real world? Well, this is a person who is receiving psilocybin therapy in Bristol. It's actually a mock-up of that. We don't photograph patients, obviously, during the session. But this is what a session will look like, quite different than those of you who may have had these experiences when you were younger or whatever, where you're out in nature. This is very much an inner experience. There's a therapist and then usually someone who's been training with them as we scale out the treatment model. There is this profoundly large dose of psilocybin. For those of you who may be interested in calibrating, it's approximately 5 grams of dried mushroom. It would be the equivalent of, obviously it's a synthetic capsule made to the highest global pharmaceutical standards, but it is a very significant experience. People have a soundtrack that we've created for 7 hours that is kind of a soundtrack to this experience that matches the action of the medicine. And it becomes a way for them to be grounded. And the therapist isn't there talking about their childhood. It's just someone there to help people if they're running into psychedelic turbulence, a bit of discomfort, to just help them breathe and so forth. And we prepare patients before this in 2 or 3 sessions before they come in, including with that video the day before. And this is kind of what it looks like in the real world. Obviously, we had just an experience where we did the largest psychedelic trial ever, just finished last year. We did it in 17 months from inception, from design to completion, which was the previous years had taken 7 or 8 years to do something like that, half the size. And we did it with 6 people simultaneously receiving psilocybin. So we're really thinking about what does this look like in the real world? How do we scale it? How do we support it with technology? But this is what clinical trial looks like right now. As I said, we are operating now. We have clinical trials operating in 13 countries. We have over a dozen academic partners looking at new indication areas. And our core program is we are doing a clinical trial right now with the European Medicines Agency and the Food and Drug Administration. We're in a phase 2B dose finding study, 216 patients. The largest study in the past was our 90-person healthy volunteer study. This is well underway. We did have a pause with COVID, but now 10 of our 20 sites for this trial are coming back online, pretty much moving from east to west as COVID has. About half of those sites are across Europe and the other half are in the United States and Canada. We'll then move into phase 3, and we're developing this as a medicine, so it would be available to patients everywhere in the world. We're committed to access, we're committed to cost-effective access and affordability for this treatment. And because of the nature of what we're doing and the nature of psilocybin that I described earlier, this kind of repetitive thinking, this kind of very self-involved thinking process, these thinking ruts, they not only characterize depression, but they characterize anxiety, they characterize OCD, they characterize anorexia, body dysmorphic disorder, a lot of behavioral addictions. And there are studies in all of these areas. We chose treatment-resistant depression to start because it's the highest impact area and will enable us to really build this. And so I think, aside for the most important slide, that's about it.
George, that's fantastic. Thank you so much. What a great presentation. Before we bring Kim on, actually, I should probably introduce this. So Kim West is married to my dear smutty friend Lloyd West, and vice versa. He's married to her. And she studied psychology and then got caught up in investment banking and private equity. But I guess she's studying psychology again, so she'll take over. But I just want to ask two questions about the company itself and the resistance to something like this. So very quickly, you've got 50 plus employees, you've raised a lot of money, and you're hiring people at the moment. But there's been a lot of resistance to this over the years. How have you broken through? And tell us a little bit about where you found the opportunity. Someone was sitting on it, a big drug company, correct?
Yes. So look, I think that when we came across this whole area, it's a very colorful area, the world of psychedelic research. There's a lot of tie-dye, a lot of crystals, and we approached it in a little bit of a counterculture to the counterculture. Go figure. I think what our view was is that there was such promise that it needed to be mainstreamed. And to really build on the wonderful work that people have done under, like those therapists I mentioned, like the early researchers, but to try to kind of build a bridge to this rather than a bridge from it. And so just given my life and the way it evolved, I just happened to be able to help by bringing some leading regulators, government officials. Our board of directors is a former chairman of Johnson & Johnson, for example, the former chief medical officer of Bristol Myers Squibb, the former head of the European Medicines Agency. So I think we did this in a way which, for lack of a better term, helped people suspend disbelief. One of the early people who was involved as an advisor, who then became an investor when he left government, was Tom Insel, the former head of National Institute of Mental Health in the US. So our whole view was this is something that's been hiding in plain sight, and it really simply needed the resources. So what resistance have we received? In talking to governments, it has been nothing but pushing on open doors. In talking to regulators, it's been nothing but pushing on open doors. Why? Because everybody knows someone, everybody has a story, everybody knows what the problem is with mental health, and it's about to get a lot bigger. And the only resistance we've had are from the people who've been deep in the psychedelic community, who think this should never be commercialized, it should never be brought forward, it's a sacred substance. We certainly understand that, and we understand the sensibility. We also understand the unmet need. And so we're trying to navigate that the best way we can. And that's really our commitment.
And last question, you've got an incredible lineup of investors. There's my venture capital hero, Peter Thiel, who like me is a libertarian, but you've got an incredible lineup. Do you want to just give the names, and then Kim, over to you?
Yeah, I'll talk about some of the folks. Christian Angermeyer, Mike Novogratz. This story has been just so interesting because Katya and I formed this as a nonprofit initially. We then realized how big a deal it would be to actually do the clinical research at scale to bring this to market globally as our vision increased. We went off on a 6-week sabbatical. I can share that kind of thing with people on this call, to Morocco and at Bali. And in Bali, we met, we were trying to figure out, what do we do next? You know, this has been an interesting adventure. And in Bali, there was a person we kept having breakfast with. And about halfway through the retreat, she said, it was the Ayurvedic retreat, she said, you know, my brother might really like this, and he's a billionaire. And that turned out to be Mike Novogratz. The same day that she wrote to her brother in email, another person named Christian Angermeyer, many people may or may not know on the call, but another really high energy investor, Christian. So Christian was in Mike's office that same day, telling him about how excited he was about magic mushrooms. So Mike types a note back to me after Amy wrote to him and said, I haven't thought about magic mushrooms since my freshman year at Princeton, but now I have, and twice in the same day, there must be something here. So Christian brought his friend Peter in, and that was our seed investment about 20 months ago. And since then, we've raised close to 120 million. That's US. You can hear my accent, but I'm in the middle of London right now. I came here to work in public health with a guy named Andrew Whitty, who's chief executive at GSK, when I was asked to help by his board on relationships with government. So, we're here because we're all about access and public health, not just about private health. Other investors, Founders Fund, Perceptive Advisors, a big crossover fund in New York in the biotech area, but also Otsuka Pharmaceuticals, who discovered us they're part of doing a 30-year strategic plan for the future of mental health, and they came across us. It's a very Japanese thing, but I think it also is a wonderful thing to have a long-term investor. Because for all of the breathless enthusiasm, we're still doing clinical trials. We still don't know if the medicine works in clinical trials. We don't know if the measures are going to be sensitive. So let's not get ahead of ourselves like we feel far too many people are. So long answer, but really blessed to have. And Founders Fund is a really exciting new investor. And obviously them behind SpaceX and others. So we have a lot of really interesting high net worth individuals and others.
Well done. Kim, over to you.
George, thank you so much for your presentation. It's super interesting, and I'm trying not to take up too much time because I know there's a lot of questions on the chat, but just 3 quick questions from me. Firstly, for whom is this type of treatment absolutely not appropriate? I'm sure there are instances where it just doesn't make sense. I'm interested to see whom those people might be. Secondly, go ahead.
Oh, go ahead. Should I answer sequentially, or do you want to just throw everything out? My memory may not work so well, so maybe I should answer one at a time. If your memory will work. So the people for whom uncontrolled blood pressure, really a big no-no. People who are on antidepressants, particularly of a particular type of antidepressant. So we pull everybody off. And this is also, I think, from our point of view, philosophically, a real benefit. If we can have people come off of daily pills that blunt them and aren't really working terribly well, that's actually a benefit for them as well. So, but if people are on those types of medicines, and this is why it's really important, people are dying in psilocybin sessions that are being conducted in the underground. There have been 2 deaths that I'm aware of this year, and someone I know of actually had a hemorrhagic stroke because the person who gave him medicine didn't realize there was an interaction with one of his drugs. So this is powerful, and therefore we believe it should be used in a medical setting. That's just our belief.
Mm-hmm. Thank you.
And the other thing is psychosis.
Right.
We exclude people who have schizophrenia in their family by 1 degree of separation. It's a really important thing.
Got it. And what are the sort of big hurdles for you for widespread implementation, given that it's a relatively time-intensive process and there's a lot of associated sort of psychotherapy?
Well, there isn't that much. There was a lot being used in the prior trials because, as I mentioned, this whole area of research was freeze-dried pretty much in 1966 and then reinvigorated in 2006, but just as it had been. CBT was virtually non-existent when this was done, so it was done in this context of long-term, years of psychotherapy. What we do is we view this not as a psychotherapy, but as psilocybin therapy, kind of like chemotherapy, where your doctor prepares you, so there are 2 meetings to prepare. There's a long dosing session, and we can reduce or increase scalability by doing that multiple people simultaneously. And then there is follow-up sessions, and we do 2, but we're also looking at digital therapy. And so in our work with payers, we think we can get this down to something that would be half of the time that someone would be in CBT. And we know CBT scales quite well. So we're looking at ways to use technology, et cetera. So we're deep in research.
And lastly, what other novel therapies are you excited about beyond psilocybin? There's obviously a lot of talk around MDMA, ketamine, opioids. Yeah, what's exciting to you guys at Compass?
A number of things. So right now we're actively working with some university partnerships that we'll announce to develop a shorter acting psilocybin to deal with exactly the question. So could we in fact develop something that is half the duration? We believe psychedelic effects are quite important, but we're not certain of that. So we're working with a number of academic groups to see if we eliminate the psychedelic effect, would the same benefit happen? So that's on the drug side. What we're really interested in is digital therapeutics, ones that can take the change that has occurred through psilocybin and maintain it through attention exercises, meditation exercises, and really looking at that. So there'll be a strong digital component from us as we go forward as well. And then in terms of substances, obviously things that we're not working on that can be quite beneficial are ketamine, R-ketamine, S-ketamine, and then a whole host of new treatments that are looking to bring about essentially neuroplasticity to accelerate learning. So all of these things, it's a really, if you're a patient, sadly, if you're a patient, this is not a bad time to be alive because innovation is coming forward, not just ours.
Got it. Rob, do you want to ask a question or two from the chat?
So we've got sort of two overlap questions. Raymond Bloom, who's one of the great impresarios, puts on all the music and DJs in South Africa, asks about the correct dosage, as he never knows. But Brandon Kersner, also a famous friend of most of us, says, how many times a year can I participate in a journey with my therapist? I've been averaging 4 times a year with a dosage of 4 grams. Golden Teachers, and then I won't read the rest, but it does say mixed with 2 grams of penis envy. Can one overdo it? Can you overdo it?
So I will comment on, could you remind me of Raymond's question again? So
it was just the correct dosage for...
Yeah, so I have to be really, really clear here that we're not developing this in a way that, so we're developing a medicine where we have very precise dosage control. The dosage is very different from mushroom species to mushroom species. It's really hard for me to comment on that in any way that'd be any more informed than anyone else. Just know that the dose that we're using 2 doses. We're testing which is the safest and most effective. We're using a 10 milligram dose, and for the average dried mushroom, that would be the equivalent of about 1.8 grams. The large dose that we're doing is approximately 4.6 grams, but we're using pure psilocybin. So it's really hard to compare the 2 substances from a dosing perspective. So that's all I can really say. My favorite, Allen Ginsberg was with Timothy Leary and Ralph Metzner and Ram Dass at Millbrook in 1963, early 63, where they had been taking days and days of high dose LSD. He came downstairs and said, I have to call the president. He needs to take this. And people discouraged him. And then he said, after he came out of it, he says, when you get the message, hang up the phone. So I think some people find that this repeat dosing is helpful. For others, when you get the message, hang up the phone, because the vantage point, the world perspective that you gain is portable and it's enduring. So in terms of your own use, I think one thing that we're curious about is this becoming a habit, a different type of habit. A world where, the journey space is a pretty interesting pace. It's compelling, but it also can change you. And I think this is kind of what we're looking at is, what is the impact of long-term use? It certainly isn't a safety issue, but it might be a perspective issue. So just throwing that out.
George, I'll ask one. Kim, you pick the next one. Dominic Mullemans, who's fantastic sales business, says, excellent video presentation. I can relate. Can you, Dom? And he asked George, when did you first take psilocybin, and how often do you personally do a ritual or healing process? And what value have you personally got for it? So he's making this about you, this question.
So our company and what we're doing is not about me. So I will be very clear about this, nor is it about our son. It was about seeing all of the people who are really, really struggling with their experiences in mental health care. So that was the genesis. It's really, we're blessed. I mean, we could pay $1,000 an hour for ineffective psychiatrists, right? Very few people can do that. And that's just a fact. It's not boasting in any way. It's actually a sad fact. And so our commitment was to really look at how we make this accessible. So independent from my personal experiences, that's why we're doing it, independent from our son's experience. It's easy to have the narrative, son takes magic mushrooms, company formed, the rest is history. That's not it at all. Life's too short to have it be this hard if we're doing it for that purpose. Personal experience, when I was young, I happened to fall into being a computer science tutor at Wharton when I was 14 years old in 1969 through a weird set of circumstances. 1969 at University of Pennsylvania was kind of an interesting time. And that was my first experience. And a dear friend of mine had a father who led a big lab there, and there was a man named John Lilly. John was doing work in sensory deprivation and research with LSD. And so he inspired some of this kind of look, and that happened early in my life. I found it an incredibly important vantage point, one that helped me deal with some of my personal early traumas and the way my life evolved and grew. And I think it was something that I had a complete holiday with for 35 years. I'd not thought about this until that morning in February 2013. And in terms of personal use, this is something that I'm a strong believer in, the quote, if you get the message, hang up the phone. I'm operating from that place really gratefully. And I think this is what's beautiful about the work. The side effect, what people say at the end of their trials or the end of many of the experiences, is they say, I'm so grateful. That's pretty cool. That's the way I feel.
The next question I'm going to choose is from Patty, and it says, how can one train to become a therapist or facilitator with you?
So we've developed a very, interestingly, we've been working with all of the elders. I had some really wonderful mentors, including Tim Leary and Ram Dass's research assistant, Ralph Metzner, who, so we've had the benefit of working with all the octogenarians from the 50s and 60s, informing our clinical trials and our therapy methods. We have a therapy training platform that's for people who are involved in our therapy. It's a very robust training that will be expanded as we go into more trials. It's available to people who are in our trials, and right now we're doing trials in 13 countries, as I mentioned. Those are going to be for people with mental health training at the master's level and clinical experience. That's all the only people we'll be doing that with, and PhDs and psychiatrists. So if you have any of those credentials and you happen to be in one of the countries we're doing trials, please feel free to reach out. Our website, compasspathways.com, has a list of all of our trial sites around the world.
And the next one is from Edward Cunningham that says, what are your thoughts on microdosing for mental performance versus medical use? I guess views on microdosing generally.
Yeah, I wake up every morning just blown away by how much is published about a medicine we know so little about. There's no other medicine in phase 2 of clinical trials that's written about as much of as this. We know very little. The controlled studies of microdosing have actually been very few and far between. They're very difficult to do. And the ones that have been done are really largely negative. So they don't show any real benefit. So we may have a placebo writ large. We don't know. We may also have a potential heart valve issue where there could be a hardening of a particular heart valve due to one of the receptors that's activated, particularly with LSD. So we just don't know the long-term safety because the studies haven't been done. So I think it's interesting to see how people respond to this, but it's not what we're doing. And it's certainly not the research area that is very robust at this point. But lots of people are doing it. Lots of people are talking about it. Caveat emptor.
George Stas asks, does synthesized psilocybin lose many of the other chemicals that are present in the mushroom that also contribute to the psychedelic experience?
So it's seen as that two chemicals, psilocin and psilocybin, are the ones that actually do produce that effect. Unlike cannabis, it is not thought that there is a large aspect of entourage effect, as it's called in cannabis. So it's not known, and what we're doing is a very pure, it's taken us years to get to this point of a very pure, accepted by regulators around the world substance. That's where we're turning into capsules that we're developing it for commercial scale eventually, if the trials are successful. But we think we have exactly the active ingredient.
Thanks, George. This question is from Coast Solinger. It says, how do you see the market for recreational use developing? Might we see an evolution to what we've seen with marijuana with some form of legalization in some parts of the world?
So I'll maybe a little bit contentious. I think there's a lot of breathless enthusiasm and a lot of conflation with psychedelics and cannabis that aren't going to be helpful to many people. 10% of the people who actually take these substances have ongoing need for psychological support. We see this at Burning Man, we see it at festivals where people do get in trouble. The Hopkins team estimates it's approximately 10%, and that's when they get in trouble if they're doing it without psychological support or preparation. So we're actually quite hopeful that that doesn't move ahead too quickly. Because we think it could actually be, we've seen the movie before, and it's called The Late 60s. And there's such promise here and such unmet need that we hope that that doesn't happen and we don't scare the horses, the children, or people. I think that the recreational, I see three different dimensions. There's recreational. There's what I kind of some tongue-in-cheek look at the market of recreational. And what this is there's a group of centers that are emerging in the Netherlands and in Jamaica, maybe Lesotho, where people can take the active substance by taking magic mushrooms. Quite often it's a bit dodgy in terms of the medical qualifications. So there's a little bit of, again, up to you. I don't mean to be overly rigid. I'm certainly not rigid, but I think just be careful. And I think that recreational area of people using this for personal development could evolve. But as a medicine, which is what we're doing, to develop this to the highest standard that's approved by governments and most importantly, reimbursed. Right? We want this to be accessible. Anybody can fly their private jet to the Netherlands or Jamaica, spend $5,000 for a wonderful weekend, but those aren't the people who are really suffering.
So we've got two great athletes that have just asked questions. We've got Roland Schoeman, who's one of South Africa's greatest swimmers, Olympic swimmer, and Paul Sandelson, who's just a bloody good golfer. And is that an athlete? I think it is. I play golf. And Roland asks, have you compared the effectiveness of psilocybin on its own versus psilocybin and MDMA for trauma, healing, depression, and etc.? And Paul Sandelson, great golfer, then says, is there a financial deck of sorts? So we'll do that later. Sorry.
Yeah. So in terms of mixing things, obviously this has been used in the underground for years. It is, again, we don't have any data, and I don't want to sound rigid again, but there is no data, right? And so We know some people are helped by that mixture in underground and psychotherapy. We don't have any data about who would help, why it would help them, etc. There's a wonderful group that we're a financial donor to support called the Multidisciplinary Association of Psychedelic Studies, MAPS, that has been courageously developing MDMA for post-traumatic stress disorder. We actively follow and support that work. They're working with the FDA. They also have breakthrough therapy designation from the FDA. So we'll see. And then I think once they have approval and we're heading toward approval, we can start doing research in that area. And this is kind of ties to the whole reason we became for-profit. We believe that you can be a socially responsible, purpose-driven business and have good returns for society and good returns for investors. And for us to do the scale of research that's needed to really answer questions definitively at scale for global population, this is a big vision, right? It's a big problem, big solution is required. We really need access to high levels of capital in order to do all of this research because this is very expensive. So that's really been driving the reason we have built the company and are building the company the way we're doing.
There are a couple of questions that I'll sort of package together, which is really about who else is busy, on this journey. I think someone mentioned, is Michael, are you involved with Michael Pollan at all? Obviously, he's a big name world. And then someone else mentioned, are you doing a lot of work or any work with John Hopkins? Because they're obviously big in the field as well.
We have a call this afternoon with the head of psychiatry there, interesting our team. So we'll watch that space. And we've been working with Roland and the team there since the beginning, just in terms of sharing expertise. And their lead therapist, Bill Richards, is one of the key people in our therapy training. He's the last person to administer LSD in the 1970s in clinical trials. And it's been wonderful for him to see this work. And we have a fundraiser for our center that we're building outside of DC tonight with him. So it's just kind of small world tonight. In terms of the prior question, I'm sorry, can you remind me again? This is Michael Pollan. Yeah, if you read the book, we're the last chapter. Michael attended, I gave a talk where I was referred to, much to my dismay, as the man, capital T, capital M, where I brought the head of the American Psychiatric Association and the former head of the National Institute of Mental Health, Tom Insel, I mentioned earlier, into 2,000 people who were probably cornered the tie-dye market for San Francisco that weekend, and brought them on stage and said, if we're going to really do this at scale, we have to be whiter than white, more Catholic than the Pope, and do better quality research than the pharmaceutical industry ever has. And so Michael attended that, and you'll see that session at the end of his book. Michael's a good friend. Just talked to him yesterday, actually, so via email. So there we have it.
So George, the last question is sort of two parts. The first part of it is, I'm sure a lot of people would love to get in touch with you or apply. What kind of people are you looking to hire in the next phase? And then the final question is, you've got a great audience here. What could they do to help you? What's your ask where we could step up and help you?
So in terms of growing the organization, I'm just blessed. I think half my job is more than half as a casting director, getting a team together. And I'm a big believer in we are smarter than me. So everything I've talked about is done by an amazing team. Don't get confused that I'm doing it. So the kinds of people we're looking at are people who have deep healthcare, scaling healthcare solutions, technology people, psychiatrists, medical researchers, clinical researchers, people from the pharmaceutical firms. So we have a broad church of everybody. We have some people from big pharma involved. We have some people from high-tech startups. My wonderful co-founder, in addition to Katya, Lars Vilde, I think he's on his 5th business. He's at 33. He's just an amazing kind of driver of tech innovation. So we're looking for everything you'd imagine of a group that is passionate about transforming mental health globally. So it's a rapidly growing team. I think the only thing that I'd say is we're really looking for super talented, super motivated people who believe in the cause and are motivated, and it's not for the faint-hearted. Our mantra inside the company is every 40 seconds. So we're not doing decade-at-a-glance calendars planning clinical trials for 30 years from now. We realize every 40 seconds.
And how can we help you? How can the audience, what can all of us do to help your
Look, I won't be, again, I wouldn't presume to know how you could help. So if you think you could help from what you've heard, george@compasspathways.com. I'm a little busy, so it may be a bit of time to reply, but, again, george@compasspathways.com. And
George, you've been terrific. You really have. I cannot thank you enough. Kim, you too, and the audience. We had a big audience today. A lot of questions we couldn't answer in time, which we might send you. But George, thank you for all you're doing for us and all you're doing for the world. Well done.
Great. And as my mom said, be careful or careful. Be well.
Very well. Bye-bye. Bye, everyone.
Bye.
See you tomorrow. Bye-bye.